How is diverticulitis abscess drainage less invasive today? Imagine a time when draining an abscess meant opening up the abdomen with a big cut and a long recovery. Today, thanks to medical advances, that's rarely necessary. Instead, doctors use less invasive methods guided by imaging technology. These methods have transformed how we treat abscesses caused by diverticulitis. Most abscesses can now be drained using a procedure called percutaneous drainage. This involves inserting a very thin tube, called a catheter, through the skin directly into the abscess. The doctor uses real-time imaging, like computed tomography scans or ultrasound, to guide the catheter precisely into the infected fluid. Because the procedure is guided visually, it avoids large cuts and reduces trauma to nearby tissues. This means less pain, fewer complications, and a quicker recovery for patients. In cases where the abscess is hard to reach from outside the body, doctors may use endoscopic ultrasound-guided drainage. This technique involves inserting a small camera through the rectum to locate the abscess and place a drainage tube. It's also minimally invasive and avoids external incisions, making it a good option for certain patients. These modern techniques are preferred because they lower the risk of wound infections, bowel injuries, and long-term disability compared to traditional surgery. Patients often experience less discomfort, recover faster, and can return to their normal routines sooner. Sometimes, drainage is used as a temporary step to stabilize the patient before surgery, or as the main treatment if surgery isn't suitable due to other health issues. The decision on which method to use depends on the size and location of the abscess, the patient's overall health, and whether there are signs of severe infection or perforation. Usually, abscesses larger than 3 or 4 centimeters are drained with these minimally invasive techniques, while smaller ones might be managed with antibiotics alone. Overall, the shift toward image-guided, minimally invasive drainage has made managing diverticulitis abscesses safer and more effective. It's a great example of how technology continues to improve patient care, making treatments less disruptive and more comfortable. But remember, every case is unique, so always consult a healthcare professional to determine the best approach for your individual situation.